Hi, my name is Ian Kim, and today I'll be presenting my research, Neurodevelopmental Vulnerabilities and Biomarker Advances in Adolescent Concussions. So first, I'll do an introduction and discuss why I chose this topic. Then I'll go through the different parts of my research and then come to a conclusion. First off, a quick introduction to who I am. My name is Ian Kim. I am currently a senior at Obert D. Tompkins High School in Katy, Texas. I was mentored by Jessica White, a psychiatry resident at UCSD. My hobbies include sports like football and basketball, cooking, working out at the gym, volunteering at my local hospital, and spending time with my friends. When I get to college, I intend to major in neuroscience or psychology. To discuss why I picked the topic of concussions. Concussions are a growing concern in adolescent athletes. The CDC estimates that about 14% of high school students, or nearly 2.3 million, sustain at least one concussion per year. Despite how common these injuries are, there is no FDA-approved treatment targeting the underlying injury. Most care is symptom-based, resting, gradual return, and monitoring. This mismatch between the scale of the problem and the tools available to the population is what I think makes this an important area to examine. So why focus on adolescents? Their brains are still developing, which makes them more vulnerable to disruption. But most concussion research and resources are geared towards collegiate and professional athletes, not high school students. This creates a big disparity as adolescent athletes face unique risks, but often get care that isn't designed for them. During adolescence, the brain is in a critical period. Synaptic pruning, where unused neural connections are formed and eliminated, as well as myelination, where axons are insulated, are still occurring. These processes can be disrupted by trauma. White matter, which connects brain regions, is especially vulnerable. The prefrontal cortex, which supports decision-making and impulse control, continues to mature into the mid-20s, making adolescents more at risk for cognitive and emotional difficulties after being concussed. Adolescents are also prone to prolonged recovery. Post-concussion syndrome can last weeks or months, affecting concentration, fatigue, and sleep. A second hit before full recovery can result in second impact syndrome, a rare but potentially fatal condition. Even without catastrophic outcomes, concussions can disrupt school performance, cause depression or anxiety, and pull teens away from peers. And the risk compounds. Statistically, having one concussion makes you 4 times more likely to sustain another. Gender is another key factor. Female athletes are more likely to sustain concussions and take longer to recover. In high school sports, girls soccer and basketball have particularly high risks. Symptom profiles differ too. Females often tend to report emotional and cognitive issues such as anxiety or sleep problems, whereas male athletes tend to report physical issues like headaches or light sensitivity. These differences matter, but current guidelines don't distinguish care by sex or gender, which can leave female athletes especially vulnerable. Beyond diagnosed concussions, there's also a growing concern about subconcussive impacts, which are smaller hits that don't cause symptoms directly, but can still alter the brain. For example, football players may take hundreds of hits to the head per season, sometimes nearly 900 for linemen. Advanced imaging, such as DTI or fMRI, shows these reported hits can damage white matter and disrupt brain connectivity. These silent injuries may explain problems with attention, memory, and emotional regulation, even when no concussion is formally diagnosed. Recovery unfolds in phases. Immediately after being injured, symptoms such as headaches or confusion are very common. In the acute phase, which occurs about 1 day to 2 weeks afterwards, symptoms continue to persist, but light physical activity may be gradually reintroduced. The subacute phase, which occurs after 2 weeks, is when cognitive problems such as attention or memory deficits appear and can overlap with school challenges. For some, symptoms can persist for months. In this case, it's known as post-concussion syndrome and can include issues such as continued poor sleep, mood swings, and lasting cognitive impairments. Care regarding concussions isn't distributed equally. Nearly a third of United States high schools lack certified athletic training staff, and it's disproportionately common in rural and low-income areas. Without trained staff, concussions may be overlooked or mismanaged. Surveys show that over 40% of athletes return to play or come back to school too early, increasing their risk of being re-injured. Minority and underserved populations are also less likely to receive proper follow-up care and tend to be underrepresented in concussion studies. Emerging diagnostics may improve accuracy regarding concussion diagnosis over time. Biomarkers, which are free-floating proteins or other particles in blood or saliva, such as the neurofilament light chain, GFAP, tau protein, or UCHL1, can reveal brain injury more objectively than symptom checklists do. Other tools include portable EEGs to measure brain activity and oculomotor or vestibular tests for balance and eye movement. AI may also help to identify athletes at risk for prolonged recovery. The challenge comes from the fact that most of these tools are validated for use in adults, but not adolescents, and access is uneven, especially for underserved populations. Despite a lot of progress, key research gaps still continue to exist. Most studies focus on adults or collegiate athletes, leaving adolescent-specific data rare. We currently lack large or long-term studies tracking youth over multiple seasons or multiple years. Representation is another issue, as most research tends to omit race, ethnicity, or socioeconomic status, which can hide important disparities. And many tools still rely on self-reported symptoms, which adolescents may underreport to continue playing. To improve care, several steps are needed. First off, every high school should have access to athletic trainers. Baseline testing and return to play or return to learn protocols should be standardized to protect both academics and athletics. Telehealth or mobile clinics can expand access in rural areas as well. Finally, we need a national adolescent concussion registry to track injuries and outcomes, ensuring more inclusive and long-term data. In conclusion, adolescent concussions are common, but dangerous and often mismanaged. Adolescents face unique risks because their brains are still developing. The effects extend beyond the field or the court into school performance, mental health, and social well-being. Current care is skewed towards focus on adults and unequal in many cases, leaving many students without proper support. Moving forward, adolescent-specific diagnostic care, equal access, and policy reform are critical. High school athletes deserve concussion care designed for their age and needs, not scaled down adult models. Thank you.